Xtalks connects professionals in the life science, medical device, and food industries with useful content like webinars, job openings, articles, and virtual meetings to help you succeed in your career. This podcast brings together some of our editorial staff to share insights into the latest B2B industry news to help keep you up to date.
Hello and welcome to the Xtalks Life Science Podcast. I'm Ayesha Rashid, Senior Life Science Journalist at Xtalks.com, and this week I'm delighted to introduce a very special guest on the show. Today we have with us Margaret Froh, who is the president of the Métis Nation of Ontario, or MNO, in Canada, and is also a lawyer by training. The MNO is the democratic Métis government of rights-bearing Métis people and communities in Ontario. The Métis are a distinct Indigenous people recognized in Section 35 of Canada's Constitution. In Ontario, distinct Métis communities emerged in various areas surrounding the Upper Great Lakes, as well as the waterways and fur trade routes of what is now known as Ontario. These historic Métis communities developed their own shared customs, traditions, and collective identities that are rooted in kinship, their special aboriginal relationship to the land, and a distinctive Indigenous culture and way of life that persists to the present day. Among the Métis people in Ontario and beyond, cancer is a significant concern, and across the Métis Nation Homeland, including women, as they experience higher cancer rates and lower cancer screening uptake than the non-Indigenous population. Cancer Prevention Action Week, which took place during the third week of February, focuses on supporting and empowering the public to make changes to their daily habits to reduce their risk of preventable cancers. Margaret is also a recent breast cancer survivor and will share her story with us. So to learn more about health issues like cancer that disproportionately affect communities like the Métis communities in Ontario and her work at the MNO, let's turn to Margaret. Margaret, thank you so much for being on the show today.
Well, thank you, Ayesha, for inviting me.
So, Margaret, I'd like to start off by asking you more about the Métis Nation of Ontario, or the MNO, in terms of what its core missions and goals are, and also about your role as president in leading the organization.
Thank you. Well, the Métis Nation of Ontario, or the MNO, is the democratic Métis government for rights-bearing Métis people and communities in Ontario. It was formed in 1993, so we've just turned 30 years old. But of course, the communities that we represent are much, much, much older. So in 1993, a group of like-minded Métis citizens and communities from across Ontario came together to exercise their inherent right to self-determination and self-government, and to advance Métis rights and interests in Ontario. And they created the Métis government, which is the Métis Nation of Ontario. We represent descendants of 7 historic Métis communities within what is now Ontario, as well as descendants from historic Métis communities in the Métis Nation west of Ontario, who now live within Ontario. So we've been around and operating for 30 years, but as I said, the communities we represent are hundreds of years old. And over the course of the last 30 years, since we founded the MNO, our Métis government has done the hard work to implement our MNO Statement of Prime Purpose, which is a document that the people pulled together and issued on forming the MNO that really talks about our history, our values, and our principles, and it outlines our objectives, where it is that we are heading. And some of those include those major priorities of advancing Métis self-government and self-determination, including Métis rights recognition in Ontario. We've been a leader in doing that over the course of the last 30 years, but also protecting and preserving the distinct culture and heritage of the Métis Nation within Ontario, and as well improving the social and economic well-being of Métis children, families, and communities across Ontario through a province-wide service delivery system that we've established. So that's a little bit about the MNO and our work. As president of the MNO, I serve as head of our provincial level of government, which is called the Provisional Council of the Métis Nation of Ontario. And we've got over 28,000 registered citizens. Currently, we've got 32 offices across the province. We've got a staff of about 450 people that are every day working to support not just our rights assertions work as a Métis government, but also that important work of supporting our citizens, our children, and our families.
It's wonderful. And you did touch on some of the initiatives and things that you're leading at the MNO. Could you tell us a bit more about some of the specific initiatives that you're currently working on as president at the MNO?
Sure. And I think specifically, Ayesha, focusing in the area of health in particular, improving the health and the well-being of all MNO citizens is a key priority for the MNO. And especially given the disproportionate impact of cancer on Métis communities, we've made numerous investments over the years in cancer research, education, and prevention. And I'll talk a little bit more about some of those, but our latest partnership with the Government of Canada is called the Canadian Partnership Against Cancer Project. And that I'm excited about. It's going to allow us to develop Métis-led health initiatives and build that cancer resilience within our communities. We're looking at funding to the MNO for a period of 3 years, beginning early in this calendar year. And we're going to be able to leverage and use Métis statistical data in order to increase awareness, resources, and access to cancer information, including screening and prevention measures, which we know from the work that we have done is so important. Historically, you and your listeners will have, I'm sure, talked a lot about the challenges and the discrimination that all Indigenous peoples, Métis, First Nations, and Inuit face within Ontario and Canadian health systems. And you don't have to look very far. More recently, stories like Joyce Echaquan and Brian Sinclair and others to hear about the challenges that exist. So this partnership will really represent another positive step forward in enhancing Métis health outcomes and well-being. So we're looking forward to undertaking some of that work.
That's excellent and very exciting indeed. And so, what are the most significant gaps and challenges? Of course, as you mentioned, there are many, specifically in healthcare for Métis communities, and what types of challenges do they face navigating the current healthcare systems?
It's a great question. And in fact, identifying the most significant health issues is really a challenge for us as well, because Métis-specific health research is such a well-recognized gap. Health research studies have often used pan-Indigenous data if they collect any data at all. And what we see in pan-Indigenous data, so approaching data collection from are you Aboriginal, are you Indigenous, check off a box, is really often what that does is erase Métis-specific experiences. That's why the MNO, alongside other Métis governments, have been investing in and leading our own Métis-specific research within our own community so that we can better understand our citizens' particular health issues. With better understanding them, we can better develop those supports in place for them and also advocate with other governments around how to address those needs. So based on the research that we've done to date, we know, specifically when we're talking about cancer, we know that Métis people in Ontario are at a greater risk for several cancers and are underscreened, leading them to suffer disproportionately. And there's been some really excellent research that we've undertaken to address that gap in data. And we've undertaken that within the Métis Nation of Ontario to be able to tell the story of our citizens and exactly what it is that they're experiencing within the healthcare system. So we published a study in 2018 that looked at the incidence rates and survival for the most common cancers among Métis adults in Canada, and we compared those with rates for non-Indigenous adults from the 1992 to the 2009 time frame. And the findings that came out of that report show that the incidence of breast cancer and cervical cancer was significantly higher among Métis women compared to non-Indigenous women. We also looked at lung, liver, larynx, and gallbladder cancers, which were also higher among Métis adults, and noted as well through that study that Métis men had significantly poor survival rates for prostate cancer compared to non-Indigenous men. So there are huge gaps in terms of the data that we have, which is one of the key things that we really have to be addressing as we move forward. If we're going to truly understand these concerns and be able to effectively address them.
Thank you so much for those insights. And um, as you said, it all starts with the research. And so getting that Métis specific research is key in order to identify the problems and then, of course, work towards the solutions. And so in some of those research findings, what did you maybe come across in terms of cancer screening? What are the rates like, and what are the challenges and barriers and gaps on that end?
Yes, we're seeing a widespread lack of Métis-specific resources and supports, which really have an impact as well on the limited cultural competency among healthcare providers, which is a serious impediment for cancer screening uptake within our communities. We did work with the Métis Nation of Ontario, Ontario Health, which at the time was known as Cancer Care Ontario, as well as Sunnybrook Research Institute to partner on a community-based study that examined the factors that were impacting cancer screening among Métis in Ontario, and jointly released a study in identifying the barriers that impede cancer screening uptake in Ontario Métis communities. And so the specific things that we flagged through that study were limited Métis-specific resources and supports, but also just a widespread lack of cultural competency among healthcare providers, knowing who the Métis are, our story, our history, limited access to screening services in many of our Métis communities, and challenges with long distance travel to access services. And these are all barriers that are continuing. That report revealed that we need more support for frontline M&O workers that are facilitating cancer screening within Métis communities, something that's just so important. Improve supports for healthcare providers so that they can engage more effectively with Métis patients, and program development and education to promote cancer screening knowledge and uptake within our Métis communities. Based on those study findings, we identified a sort of a best case cancer screening pathway, and that was streamlined into 4 key steps as understood by our communities. So the first one being knowing about cancer screening, so that education and that awareness piece, so important. The second being just making that decision to go out and get screened. There's a lot of fear and anxiety around this. The third one, of course, taking action. So, actually booking the appointment, getting to services, completing those tests. And the fourth was following up. It seems so simple, but getting the test results, completing the further testing as needed, or initiating screening again when it's appropriate. So we've identified that pathway, and we will continue to put resources into addressing those to the best of our ability to ensure that our citizens are in fact overcoming those barriers to screening.
And I know that the impact of just stories of individuals and people in the community can also have a big impact and help to raise awareness about things like cancer screening. And so, Margaret, I know that you're a breast cancer survivor, and so I'd love to hear your story and how you're using that to really build awareness within Métis communities about the importance of cancer screening and prevention.
Yeah, it's something that it's still new enough to me that I sometimes I forget to introduce myself in that way.
I hate to have
yeah.
those kinds of labels or those kinds of titles, but I mean,
Yeah, no, I'm actually fine with it. It's just still a little bit surreal. And so I do try to remember to take the time to do that, because as you say, it's people's stories that I think can really be compelling for individuals. So for me, during COVID, we fell behind. My spouse and I fell behind in our routine medical follow-up. In those early days of COVID, doctors were telling you don't come to our offices unless there's something really wrong. We fell behind in our routine mammograms. And so I remember sitting at my desk early in 2022, and my spouse Rachel said, we're behind on mammograms. I'm going to go and get those scheduled for us. And I said, that's great. Please do that. Get that done. And so I think especially for me, given the history in my family, this is something that is important, and I've been doing some follow-up on. So I am one of 8 kids in my family, My maternal grandmother had breast cancer, and of my aunties and uncles on my mom's side, three of them have had cancer, two of those breast cancer, one of them colon cancer. My uncle died of prostate cancer. My father had prostate cancer. My brother has had prostate cancer. Another brother has had bladder cancer. And then, of course, there's cousins and others as
Mhm.
well within our family. And so it's there's been an awareness, and uh, that's not a something that's rare, unfortunately, within Métis families and communities. There's a high incidence of cancer. So I had been trying to keep up on these things, but of course, Rachel intervened and got our mammograms booked, which is great. So in early in June of 2022, I went in for a routine mammogram, and they found something. And at the time, I just went in for my routine screening, and they called me back on the next business day. I was, of course, out in some other province doing business, but within a week, I came back and I had my follow up for their mammograms, for their ultrasounds, for their meetings with the radiologists. And all of that indicated that I actually required a biopsy. I was able to do all of my cancer diagnosis at Princess Margaret in Toronto. I live in Barrie, and so I had access to that. So many of our citizens don't have access. But I was fortunate that my cancer was caught very early, and we determined a solution in terms of surgery plus treatment, and I was able to fairly efficiently go through that process of having the biopsy done, the diagnosis, meeting with surgeons, and then actually going forward having the surgery. I then went through a full course of chemo and then a full course of radiation, which I finished just over all of my treatment. I finished just over a year ago, and was able to ring the bell and bang the gong, and thankfully,
Congratulations. Yeah.
thank you very much. But it was a very challenging process, a very scary thing.
Yep.
When I was diagnosed, my spouse and I, we talked about how do I want to talk about this, especially given my role. And I made the decision very early on that as president of the Métis Nation of Ontario, and knowing what we know, given the Métis specific health research that we've done, that cancer is such an issue within our communities. I have a microphone in my role as a political leader within our Métis Nation government, that I would use that microphone. So we made an announcement even before my surgery to all of our citizens across Ontario, and I had the opportunity to tell them, I have cancer. It was caught through a screening process, and please, all of you, go out and get your cancer screening done. My path has been, I've been very blessed. I've been very fortunate, and I'm grateful every single day for that. But just spending that time to talk about having a cancer diagnosis and to talk about how critical cancer screening is was really important to me, and I am very grateful that I've had many of our citizens and staff and others that work with us have approached me to say, because you talked about it, I actually booked my cancer screening. And I've had some of them come to me in fact, just a couple of weeks ago, one of our staff approached me to say, you talked about it, and it made me think it's time for me to do this as well. I did do a cancer screening. I did have cancer. And because of that early screening, I am now cancer free. And so it's a good reminder for me of just how important that messaging is to continue to do that. And so I would just again encourage everyone to book their cancer screening appointments. And if you do that on a very regular basis, I think it could give you some comfort and confidence that you're doing your part in keeping yourself cancer free. Our community, our culture is really one of thriving, vibrant communities, and that really depends on good health and well-being.
That is such an excellent message, and a wonderful story, and a wonderful example of, as they say, leading by example. And that's essentially what you're doing. And so I can only imagine getting a diagnosis like that and then having to deal with your own um, journey and emotions, and then having to also, or not having to, but choosing to share that. So I think that's very empowering in a way, for both yourself and for the community. And like the examples that you gave was fantastic, where people came up to you and said that they had actually,
It made the
it
difference.
made the difference, that they
Yeah.
actually went out and got screened themselves and
Yeah.
found that they had the cancer. So yeah, just we sometimes take for granted even the not the simple, but the small things, and just speaking out. So that's this is just an example of how important it is. So thank you so much for doing what you do.
Well, I'm great. Like I said, I'm grateful that I had access to those services. The
Yeah.
reality for many of our citizens is that they're living
Mm.
in northern or rural
Yeah.
communities where they don't. For me, I had access to diagnostics down at Princess Margaret and
Yeah.
surgery. I was also able to have all of my cancer treatment here in my home community in Barrie with a
Mm.
wonderful regional cancer center. That was fantastic, and a shout out to everyone at the Royal Victoria Hospital in Barrie. But access to these,
Mm.
to even screening is something that can be a challenge. And so, all the more reason to really promote that and encourage people to take those steps and get it done and to do that important follow up.
Mhm. Absolutely. And you mentioned that access is a big problem, of course. And so to improve really healthcare systems access and ultimately health outcomes among Métis communities, what steps do you think need to be taken across the board by policymakers, healthcare administrators, drug developers, advocacy groups? Because we know that um, it's a multifaceted effort and so involving different stakeholders is key. And so how do you think that all of these different facets can be brought together, and what is the type of work that needs to be done in order to facilitate better access and better outcomes for communities like the Métis?
Yeah, it's true. And absolutely more work needs to be done to improve cancer screening and outcomes among the Métis. This disease really is impacting our families and our communities very, very deeply. So we've been doing that work that I mentioned earlier, with different healthcare partners to do our part in creating that shared understanding of cancer in Métis populations and to really develop targeted resources and interventions to help reduce cancer rates. So we know, just going back to the last question, we know about those high breast cancer rates and low cancer screening uptake being a major issue among Ontario Métis. We know that unfortunately Métis people in Ontario not only experience higher incidence of cancer than non-Indigenous people, but also undergo regular cancer screenings at a much lower rate. So Métis women are well below the national target screening rates for routine mammograms. But what we saw through the study that we did was less than half of the Métis women aged 50 to 74 have routine mammograms, and that that's a stat actually that came out of a 2015 M&O Cancer Care Ontario report that we published, and that's compared to almost two-thirds in the general population. So what we are seeing through the research we're doing is that Métis women with less education or lower incomes have especially low rates of mammography screening. And that, so the studies like we've done there, we have worked to address those gaps, working with healthcare partners to develop Métis specific screening correspondence and to expand mobile screening options. We've also been training our own frontline staff members within our Métis government to support cancer screening and offering medical transportation. We've also been helping healthcare partners develop culturally specific education resources and programming, and working with hospitals to do that. I think what's really important is that we need to create those Métis specific and supportive services, as well as tailored healthcare resources and interventions that address those specific needs and cultural contexts of our communities. It really does need to be Métis community driven, I think, for it to be very effective. So for healthcare providers and other stakeholders to develop culturally specific services, they really need to work with the MNO or with our sister Métis governments, whatever jurisdiction you're talking about, and our communities. And that involvement and partnership really will foster a sense of ownership and empowerment for our people, which I believe will lead to more sustainable health initiatives and better health outcomes over the longer term. But we also need to keep working to eliminate systemic racism within the existing healthcare system, ensuring that Métis, that First Nations and Inuit, that all Indigenous people receive safe and culturally appropriate care. And our work in partnership with Ontario Health and Sunnybrook Research is a good example of how we can bring our Métis government and these other healthcare institutions together to improve health outcomes within our community. So we're doing some good work there, and there's so much more work to do. But I think one thing I truly believe in is that our communities actually have a lot of answers to help inform reform in the broader system.
That's a great sort of take for sure that the answers are within the community. The Métis know what they need, what they want. And do you think in terms of like the steps that can help foster a healthier and more empowered Métis community in Canada, among the community, what do you hear are the things that they'd like to see and the solutions and the steps that they'd like to take?
Yeah, so as we were saying, it really, I think, needs to be driven by and informed by Métis communities and our experiences, right? So anything, you've heard that nothing about us without us. Anything that is going to be hoping to address the needs of Métis people needs to engage with Métis governments. And as we move forward on our path, that MNO statement of prime purpose and our path, it's those inherent rights of the Métis that are recognized under Section 35 of Canada's Constitution that have to be upheld and affirmed. So our rights to self-determination and self-government have an absolute impact on our collective well-being. And those are rights that have to be respected to foster healthier, more empowered Métis communities in Canada. We're not just looking for formal recognition of our long established governance, for example, as Métis people, but active participation and consultation in shaping those policies that affect our lives. And that includes policies impacting healthcare delivery and services. Very recently, the Supreme Court of Canada issued a decision on Bill C-92, which is an act respecting Métis, First Nation, and Inuit child welfare within this country. And the Supreme Court of Canada talked about, in Canada, we have Indigenous law, we have common law, we have civil law, and that really the work that we need to do is really to braid those various laws together in an approach that will be respectful of our right as Indigenous peoples to be self-determining. And that's it's the same when we're talking about our experience of our children in the child welfare system as one example to the experiences of our citizens within the healthcare systems. So self-determination and respecting those inherent rights, that's one of the most important initiatives that we're engaging in right now. And in fact, that's work that's underway for the Métis Nation of Ontario, but also our sister governments of the Métis Nation Saskatchewan and the Métis Nation of Alberta. All three of our Métis governments are advancing that recognition of Métis self-determination through the passage of Bill C-53, which is our federal recognition legislation, which is currently making its way through Parliament. It is the legislation that'll be the cradle or the framework that our self-government agreements sit in, and any future government agreements that we negotiate with Canada, including in further future areas of jurisdiction, potentially in the area of health, as an example. But that Bill C-53 really is a fundamental piece of legislation which will recognize Métis self-determination over our own internal systems, our own internal matters of governance. Including our right to take care of our children and our families. So that's actually a very important step, a key step, I would say, in fostering a healthier and, as you say, a more empowered Métis Nation within Canada is that recognition of our right to take care of ourselves and our own people. Self-government recognition would allow us to continue building our capacity as a government to develop culturally specific healthcare services, but all those educational resources, programming, so that we can actually meaningfully address the health inequities and gaps that afflict our communities within our own nation.
Such an important message, and such important work that you're doing with and for your community. Margaret, I'd like to thank you so much for being on the show today, for your time and for sharing all of your insights, your story, your work, and really highlighting the Métis community and the potential for what it has through, as you said, fundamental self-determination and the right to self-governance, and essentially, that and how such a rich and vibrant community can contribute to our greater society today that we have. And we really need that to happen. So thank you so much for those insights.
Well, thank you for having me, Ayesha.
That's the end of this episode of the Xtalks Life Science Podcast. If you liked today's show, don't forget to rate, review, and subscribe. Thank you everyone for joining us today, and we'll see you next time. Bye for now.
If you enjoyed our discussions today, please share the episode with your friends and colleagues, and be sure to subscribe in order to be notified when a new episode is released. To join in on the discussion, you can find Xtalks on social media, email podcast@xtalks.com, or comment on the articles directly. Links are in the show description. Take a moment to join our community at xtalks.com to get access to everything we have to offer, including webinars, job listings, virtual meetings, articles, and more. The views and opinions expressed in the podcast are those of the speakers sharing them. They should not be taken as professional advice and do not necessarily reflect the policy or position Honeycomb Worldwide. For further information, email us at podcast@xtalks.com. Thanks for joining us, and we'll see you next week.